said, empty your mind. Be formless, shapeless, like water. Now you put water into a cup, it becomes the cup. You put water into a bottle, it becomes the bottle. You put it in a teapot, it becomes the teapot. Be water, my friend.
So Amy, welcome to the Flow Grade Show.
Thanks, I'm excited to be here.
I'm excited to have you on after we've met in London at
Yes.
the Health Optimization Summit. And since I found out that your superpower is sexuality, and you know the Flow Grade Show is all about flow, so about the state where you feel and perform your best, I thought, what a great opportunity that will be to get you on. And now you're here.
Thank you, I'm excited.
And I already mentioned it. So during your presentation, which I, by the way, thought was great, you mentioned that you had a superpower, which was feeling rain at first.
Yes.
I think it was. And then it turned into sex later on. And my first question would be, like, how did you find out that sex would actually be your actual superpower?
So about sex and sexual health and how important sex is for general health. And so what I realized is that sex is actually my superpower, but it's also everyone else's superpower. We don't know it. But sex has the ability to make us healthier in so many different ways, from physical health, emotional health, mental health, spiritual health. All of these things are linked to sex and sexual health. And so I feel like if we focus on our health, then we would actually see benefits in all parts of our lives and all parts of our health, which I think is a pretty cool power.
That is an awesome power. And I think that there are not that many people right now in the biohacking space that do it at a level that you're doing it. And how did it actually happen that you got into the biohacking space? Like, how were you discovered? Because now I see you everywhere, it seems like.
Yeah. So initially I was an ER doctor for a long time. That's actually my background. I did emergency medicine for about 10 years. And then I started getting interested in integrative medicine or regenerative medicine and kind of, using your body to heal itself. And I kind of went down that road. And then what happened is I started seeing a lot of patients who would come in and they would have kind of some kind of vague complaint like fatigue or weight gain or lack of motivation or something. And we'd work on them. And then after a few months, they'd come back and they're feeling better. But then they would say, you know what, you helped me with that. Can you also help me with my sex? Like, help me with my sex life. And I heard it over and over again, so much so that I was like, there's something to this. I feel like if people kind of get that foundational health, in place, then the next thing that they're thinking about is what can I do to make my life even better? And that's where sex comes in. So I became interested in sexual health and using kind of integrative medicine and regenerative medicine like stem cells and other types of medicine to improve sexual experiences. And eventually I met Dave Asprey. I treated him I guess for the first time about 4 years ago, treated him and his wife, Lana. And that kind of started us down this whole biohacker, pathway and started speaking at the events. And now, I don't know, now I'm here doing that a lot.
Because just to get it straight, so you're not a sexual therapist, but you are a medical doctor. And that's
exactly
who sort of then chose sexuality as your field that you're sort of promoting now and going out, but you're doing other things as well.
Yeah, exactly. So my whole practice is I use a lot of integrative and regenerative techniques. And I tell people I'm sort of the skin and sex doctor. So, because I do a lot of work with skin and helping with, skin health and improving skin and hair. But I also work a lot with sex and sexual health. But there are a lot of interesting overlaps between those two fields. But I use a combination of, all different things, whether it's hormones or lifestyle changes or, sort of higher let me start over there. Or I use, other things like stem cells or sort of more recent advancements to try to improve patients' sexual experiences and to help patients have sexual longevity, which I think is, plays into this biohacker world. People in the biohacker space are trying to live to be 120, 150, 180, like whoever you talk to, it's always different. But my question is, if you're going to be 120 or 150, like, do you still want to be able to be sexually active? And so what I'm trying to do is give people the tools to ride that wave for as long as possible.
That's certainly one problem. As far as I understand, though, it is that in our modern times, sexuality also becomes more of an issue Do you see that in your work as well? That is that lifestyle factors and access to technology and such things as online porn and so on that do influence sexuality medically?
Yeah, absolutely. I think that the main thing that I see that influences sex and people's sex lives is stress and just sort of our chronic state of like a very high stress. And, I think it's interesting because you have to have some degree of parasympathetic, of relaxation in order to have a fulfilling sexual experience. And, you think about it from like sort of the caveman days where back in the old days, they used to occasionally be super stressed out where they're being chased by a tiger and they're running and they're super stressed out. But then like after that, is if you live, then you go back to camp and you're making baskets and you're relaxing and you have this like downtime. And what we see now in our current, situation is that most of us don't have a lot of downtime. We're at this very high level of stress all the time. Whether or not we're actually doing something, we're stressed out by emails and technology and texts and, all these things. And so we don't have that downtime. And I think that that our sex lives are suffering because of it, because you actually need that downtime to be able to make the right hormones, to be able to have the relaxation and the parasympathetic response that we need to have sex.
So as far as I understand, then you do two things. So you educate people about how to reduce their stressors in their life, and you also make them more capable of dealing with the stressors with, let's say, medical interventions. Is that right?
Yeah, I mean, I think that this, stress is a big part of it because obviously our brain is our biggest sex organ in our body. So I work with patients. I'm not a therapist, so certainly if it's something that they need to see a therapist for or a psychiatrist or a psychologist, I'll have them go see that person. But I think, there are some simple things like meditation and mindfulness and, breath work and things like that I can teach patients to do on their own to kind of begin that journey. And if they need more help than that, then they would go see somebody else.
All right. Now, I think that most people understand, okay, having sex is fun and it gets you into a flow state and it improves the relationship and so on. But from a medical perspective, what are actually the health benefits that come from having sex?
Yeah, it's so fascinating because there are so many things that can be helpful, that sex can help with. So we know that people who have active, healthy sex lives have better immune systems, so they're less likely to get infections. So they've got just better immunity. It helps with sleep, and of course we know that if you're getting better sleep, then you're also making better hormones, and that of course has its whole own sort of chain of events that it can help with health. We know that sex will decrease stress, and that people who are having regular healthy sex are less likely to have depression and anxiety. They're less likely to be lonely. They're more likely to have better self-esteem. And of course, there's all kinds of things, health benefits that go with all of those things. And then there are a lot of cardiovascular benefits as well. So sex and a healthy sex life will decrease your blood pressure and has been tied to decreased heart attacks, strokes, and things like that, as well as just decreased overall mortality. There are actually studies that have shown that men who have sex regularly, like about 1 or 2 times a week, they have about a 50% less mortality rate over a 10-year period, which is fascinating, I think. And there's probably a lot of reasons for that. But there's also cognitive benefits. So sex actually helps your memory. Older people who are having sex more frequently have better memory and better cognitive function than those who don't. So, this is like the newest nootropic that's been around for forever, which is just have sex. So there are a lot of things out there, a lot of good reasons to do it.
So now what I'm sometimes struggling with, especially after hearing the talk by John Gray at the conference, is my definition of sex. Because having sex, apparently, in my brain, it was always connected to having an orgasm. So, having sex meant at the end, at least, for a man, having an orgasm.
Right.
And now John Gray would say, you can have sex without having an orgasm, and that is actually healthier. What's your take on that?
Well, there's a separation between orgasm and ejaculation, right? There's two different things.
Okay.
So that's, I think that, I don't know what John was talking about exactly, but it is possible for men to have orgasms, but not to ejaculate. And a lot of people talk about, that you can train your body to do that. And that might be better than having ejaculations every time. As far as the research into the benefits of sex go, there's all different types of studies. Some of them are actually looking at orgasms and benefit of orgasms themselves, whether that's with a partner or just with yourself, and the hormonal changes that we see, the oxytocin, the dopamine, the serotonin releases, all the sort of good hormones that get released during that. And then some studies are looking at actual sort of coupled sexual experiences and the benefits you see from that. So it depends on kind of what research you look at. But I think that John was probably talking about the separation between orgasms and ejaculation.
Yeah, I see. Okay. And that leads me actually to the next question, which is there a difference between men and women in that sense?
Yeah, I mean, there are a ton of differences between men and women, obviously, but both men and women are capable of having orgasms, multiple even with men during sex, and certainly we see some of the same types of benefits as far as the hormonal releases between the two of them, but as far as the benefits of sex, most of the studies that have been done in men, as far as looking at like long-term health benefits. And that's true, in general, unfortunately, in a lot of the health data that we've seen. Men are oftentimes more studied than women. But I think that we're starting to see more research into women and women's sexual responses and sexual health. And so we're starting to see more of that now, but it's just not as prevalent as the male research.
I see. Okay. Because actually, I came across I forgot the name of the company. It was something with taste, I think, at the Bulletproof conference, which dealt with oming or orgasmic meditation. And that was focused on women. And for the listeners who might have not heard of it, it's a practice where you practice, stimulation over a period of 15 minutes. And it doesn't have to end with an orgasm, but it's sort of an orgasmic meditation without the stress of having to orgasm. And I was introduced to that, and I thought that was quite fascinating. And then the girl I remember that was at the booth there talking to me, she said, "Yeah, well, for me, oming is like having my daily cup of coffee."
So there's something very, like you said, there's something very flow state about and very meditative about sex. And that could be, by yourself or with someone else. And it could be, whether or not you reach orgasm or not, there's something very meditative where you're just really focusing on being present and being in your body and not thinking about anything else. And so I think it could be pretty powerful.
So in terms of, okay, we now have all those, techniques in order, like oming, for example, that come up in the biohacking world trying to help people relieve the stress. But what do you consider powerful methods in order to improve your sex life?
So when I talk to patients and other people, I talk about kind of 6 main things that you can do to improve your sexual health, whether you're a man or a woman. And some of those things are things you can do at home on your own, and some of the things you would need a doctor or some other person to help with. So the first one is just taking care of your body. We know that doing anything that decreases inflammation is going to be helpful for your long-term sex life, because you got to keep those blood vessels open, keep the blood flowing down everywhere, but especially down into the genitals if you want to have sex. So, avoiding all the things that cause inflammation, sugars, high blood pressure, smoking, obesity, all of those things are going to, that's going to be helpful to avoid those things in order to have a long-term sex life. We talked about the stress component and making sure that you kind of, I say, mind your mind. So basically focusing on stress and understanding where that is coming from and sort of trying to modify that is another part of it. And then the other things are increasing nitric oxide is really important. As we get older, we make less and less nitric oxide. Nitric oxide is the main chemical messenger that tells your blood vessels to vasodilate. So they're this big and then they become this big. So that is all nitric oxide. And as you get older, after about the age 40 or so, you are making quite a bit less nitric oxide. And so lack of nitric oxide is actually a major cause of erectile dysfunction in men. They just don't have enough of that chemical to open the blood vessels up so the blood can go to the penis. And actually medications like Viagra, they work by keeping your own nitric oxide around longer, but you still have to have that nitric oxide or those medications won't work. So things that you can do are like eat nitrate-rich foods. So things like green leafy vegetables, arugula, spinach, kale, beets are really high in nitrates. Avoiding antiseptic mouthwash is really important because the bacteria in your mouth they're actually bacteria that are responsible for converting nitrates in foods into nitric oxide in your body. And if you're using mouthwashes that are killing those bacteria, then you can't do that. And so people don't know about that. And avoiding stomach acid blocking medications is also really important for that step. So anyway, increasing nitric oxide, exercise helps with that, low level light therapy, sunlight. Like there are a lot of things you can do, but increasing nitric oxide. Optimizing hormones is really important for long-term sexual longevity. So, looking at things like estrogen, progesterone, testosterone, those are all going to generally go down with age. And there are a lot of ways you can do that from a lifestyle standpoint, as well as medications to try to get those levels back up again, to keep everything working kind of in harmony like it's supposed to. And then I also talk about some of the sort of light, sound, and energy-based treatments that are out there. So, for example, shockwave therapy, which is an amazing treatment for men who have erectile dysfunction or any kind of lack of sexual performance, if you will. Shockwave therapy uses high intensity sound waves that we deliver it just into the penis. It's, non-invasively. It's just like a 30-minute treatment, and it essentially opens those blood vessels up, recruits more blood vessels, recruits stem cells, and you get this regeneration. And we're actually able to turn back the clock on a lot of these guys who had ED for years, and now they're actually having normal erections and don't need medication, and it's pretty phenomenal. So shockwave therapy is a big one.
How does it look like? Is it there's a mat over the penis then, or?
It's like a little gun almost. It's like a machine that has like a gun shape, and you just basically, if this is the penis, or if you can see, you're basically just going along. This is done in the medical office usually.
Okay.
Although there are some home devices out there now, but you're basically just sending the sound waves directly into the tissue, and you do usually a treatment series, like 6 treatments, maybe over a few weeks, and you can actually restore a lot of blood flow that you thought you'd lost, which is pretty amazing. So there are a lot of those types of things, lasers, radio frequency devices for women. There's some home devices for women that I love, like the VFit Plus is really good, or the Intensity device, which use like light or sound or other types of stimulation to help increase the strength of the pelvic floor muscles and the vaginal health. And I'm going on and on, I know, but there's so many cool tricks and things that you can actually use to help restore healthy tissue in those areas that I'm a big fan of.
I see. By the way, little side note on the nitric oxide, because that is an important part for the flow state as well. And there's actually a story about the London Olympics in 2012 where they were called the Purple Olympics because people were abusing, in a way, because it was legal, beetroot extract.
Oh, yeah. I did not know that.
In order to get into a flow state, because it flushes out the stress hormones as well. And gets you into that state. So that makes perfect sense, actually, that it also helps with sexuality.
Yeah, absolutely. Yep, exactly. It's awesome.
One thing that you're also known for, which to me sounded very scary at first, was injections of stem cells.
Yes, I forgot that one. That was like something that So that's actually one of the things that I've treated a lot of people with. But I do injections of stem cells in men and women, in men into the penis and women into the vagina and clitoris, using either the patient's own stem cells or using like exosomes, which come from other like umbilical cord stem cells, or even using like platelet-rich plasma, PRP, which is done everywhere, I think, in the world at this point. So I use usually a combination of those things, these regenerative tools to basically get your own body and your own cells that are already there to become more active and to start healing themselves. So I tend to use these stem cell injections in combination with other therapies, but we're able to really change sexual responsiveness and pleasure and all kinds of good things with those kind of therapies that are really fun.
And just to clarify, this is not only for people who have problems, but it seems like that also healthy people that want to, let's say, still be sexually active when they're 120, they do that in order to improve their performance and their longevity in that sense, right?
Yeah, exactly. So I have a lot of patients who are, people that you have had on their podcast before, like Ben Greenfield or Dave Asprey, or people like that who are, they're healthy. They don't really have problems, but they're just interested in kind of, keeping things at a high level. And even those people who didn't have problems to begin with, when I talk to them later, they talk, they see me like across the room and they're like, Amy, my sex life is so much better. And they're like, the sensation is so much better. And I'm like, awesome. It's good to see you. Like but they see improvements, a lot of them, even if they didn't have problems to begin with. But just, because things change as you get older, even if you're not that old.
By the way, that brings me to another device that a lot of my female listeners, some of my girlfriends out there, asked me to ask you, and they said, ask her about the VFit.
Yeah.
Because they saw that apparently on your Instagram, and I actually saw you with it as well. It's a device that kind of looks like a vibrator, but it's not, I guess.
It does. Yeah. It's funny. We had some people in our house recently. So I have a VFit, and I had it like on my nightstand, because I use it. It's like 3 times a week. You have to use it for like 12 minutes. And so I keep it on my nightstand, like underneath it, so that that I could just have it there. And we had some people in our house recently, and they were in my room, and they were like, what is this? It's just my VFit Plus. So VFit is a really cool new tool that's been out for about a year or so now that uses light, uses like red light therapy in combination with vibration and heat. And it's a vaginal at-home dildo-looking device that you just do for 12 minutes at a time. It's not painful. It's actually very relaxing. And it over time, over the course of about 2 months or so, increases the health of the vaginal tissue. So you basically get better blood flow. It can help with stress urinary incontinence, which is like when you pee a little bit, when you cough or jump or sneeze. And a lot of women have that, especially people who've had children. So it can help with that as well by strengthening some of the muscles around it, and it can help with pleasure and sensation and things like that. And it's a pretty cool device because it's really easy. Like you could just, I'll get in my bed for like nap time sometimes, and I'll have like my red light therapy over my face, and I'll have my VFit going, and I have the lights down low, and I have my like waterfall sounds on, and I'm just like that's like my meditation state. So it's fun. I suggest everyone should do that.
That seems like extreme biohacking right there. All right. Do we have already the 6 steps concluded? I didn't count.
We did, but I kind of went off. Yeah, we had the 6, which was take care of your body, right? Hormones, nitric oxide, the sound-based therapies like shockwave therapy, and the light therapies like lasers, and then stem cells. Oh, and then your mind. Take care of your mind. Mind your mind.
How do you do that?
You do that by at least understanding what stress is and sort of thinking about like what's going on around you and trying to be present and and some of the things like that, like whether it's yoga or meditation, things like sort of working on mental health and being relaxed as much as possible, getting out of that stress state.
By the way, even if you would have forgotten that I remember I wrote down I was a good student during your talk. I wrote down the 6 steps, and I actually had them in my summit review after, so I could look it up as well.
Oh, good.
All right. I know this is not necessarily your field. I know I wrote it down in the notes. I wanted to ask you about that. So from a non-medical perspective, is there something that you recommend couples to do in order to improve their sex life? Is there something that they can do maybe together?
The things that I see that the couples that are the most successful couples that are, kind of have been together for a long time are actually the people who are, they do things together, outside of sex, but do exciting new things together as couples, whether that's, travel to new places, or they take up ballroom dancing, or they're learning, or they learn a new skill, like things, they do things together to improve themselves. But also I think that I see a lot of patients who are happiest when they're also improving themselves just alone. Like for instance, the woman is improving herself by she's going to school and she's doing some new things, and she's sort of not letting herself be bored with her own person, and he's doing the same thing. And I feel like when both people in the couple are actively trying to improve themselves and learn new things and grow in different ways, that actually ends up making them more interesting to each other, and it makes them have stronger relationships. So, it's not, I think obviously you should should do things with your partner that are exciting and fun and have adventures. But I also think that improving yourself and learning and growing on your own can be a really powerful way to bond with your partner, because they see you in a different way and they think, oh my gosh, that person's pretty interesting. I think I'll stay with her, you know? All
right. Actually, another question that I'm being asked a lot, and I'm also not sure if you want to comment on that, but it's girls who take the pill and they're thinking about not taking it anymore. From my perspective, I would always recommend, if they don't have to, don't take it.
Right.
Do you have something to add to that, or what do you recommend usually that if girls come to you and ask you about that?
Yeah, I mean, the pill, I certainly see value in it. It's been a good thing for a lot of people, but it is a hormone that can affect women in ways that are not ideal. It can, disrupt the hormonal system in ways that can be really, really sometimes dangerous or sometimes at least irksome. So I think that if you can get off the pill, great. There are other methods of birth control that you can use. IUDs, the non-chemical IUDs can be really nice, that you don't have a lot of side effects from those usually. Condoms. They're annoying, but they do work. So I think, it's probably best if you can get off the pill. That's great. But at the same time, if you're on the pill and it's not causing you any problems and you feel good and it works for you, then stay on it. I don't think that there's necessarily, you don't have to get off of it, but I think that it can be bad for some people. It can cause weight gain. It can cause some mental, depression and things like that. For people who are very sensitive to it.
Okay. Yeah. Thank you for that, especially that very, diplomatic approach, because oftentimes I had a man on before actually who was totally against the pill, and sometimes it's very difficult, especially for women who want to take it. And so right. I think it's always good to hear, okay, this should be maybe looked at individually as well, like so many other things.
Yeah. Yeah, I think there's no hard and fast rule about the pill. I think that if it works for you, then that's great. And if it doesn't work for you, then find something else, because there are a lot of other options out there as well.
Is there something from a supplemental point of view, so supplements that people can take in order to increase their libido or their sex hormones?
There are a lot of hormones out. I mean, there are a lot of things out there that are said to have some influence. Like DHEA can sometimes be helpful, especially in women, because DHEA is going to be converted to testosterone in both men and women, and it'll be can help increase testosterone in women more than men. Maca and some of the other herbals can be helpful for some people. The things like the nitric oxide boosters, like Neo40 or other types of nitric oxide boosters, can be helpful for both people. There are some other things out there as well, but I also think that just getting hormones checked, getting your own levels checked, and seeing where you are, and then also talking to your doctor if you have if you have low testosterone, for instance, knowing what it is and where you are is helpful. And then you could do other things, like you could exercise more, do high intensity exercise training for testosterone for men, for instance. Other things that we know could increase it are vitamin D, selenium, zinc, branched chain amino acids can be helpful. So good protein in your diet. Getting sunlight can increase your testosterone levels. So there are a lot of things like that, but I think it's great to get your baseline checked and see where you are, and then you can take the necessary steps to decide if you want to improve those things.
That's actually some of the things that you just mentioned. Also, Ben Greenfield recommended them, especially I think he said Maca, which was more of a testosterone booster for people who want to be more fitness focused. So we talked about bodybuilding most of the time, but okay, that makes sense. Is there actually something that you learned during your work that really surprised you about sex that you didn't expect before? Something that you...
Yeah, the thing that I've learned is that a lot of couples don't ever talk about sex. Like, I have couples who have been together, they're 45 years old, they've got 5 or 6 kids together, and I'll see one of them in my office, and they'll have some kind of sexual problem, and I'll say, well, how does your husband or wife feel about this? And they'll be like, oh, we don't ever talk about that. We've never discussed it. And it could be something like erectile dysfunction, where you're actually not having erections, that are capable, you can't have sex, but they're not actually discussing it with their partner. So what I've been surprised with is just the lack of communication, even in people who otherwise are great communicators. They're raising kids, they have a family business together, they live together, they're best friends, they're partners, but they don't actually talk about sex, which I think is unfortunate, but something that I see every day.
Yeah, and I think you mentioned during your talk as well that there was a number out there, 20% of marriages are sexless or have trouble.
Yeah. About 20% of marriages are considered sexless, meaning they don't have sex, more than a couple of times a year.
Wow.
And that's more in certain countries, like in Japan. That's becoming even higher numbers there. It's just sex is not, people are kind of putting it on the back burner. They're focusing on careers and other things, checking their email, and they're just not making time for sex these days.
All right, Amy, I can feel your passion about the subject, and thanks so much for sharing so many things. I have a couple more questions more personally for you and about how you get into flow, and if that's okay. But
yeah,
that part already I think is quite round. It gave people a great introduction in your work and what you do and what they can look into. And we'll link to all the things in your website. I know you have a PDF out there that people can get when they enter the email address as well.
Yep.
So we'll do that. And my first question will be, since we are in the Flow Grade show, and I usually ask that question, is what is your favorite flow activity other than sex?
I have two. So I have two activities. One of them is walking in the woods, going on a hike. I live on I live in Utah, next to a whole bunch of trails, and just going on a nature hike just puts me in this amazing flow state. It's where I've developed all of my all the talks I've put together. They're always done while I'm walking up in the mountains. So that's number one. And the other one is I do yoga almost every day, and certainly that's a great way to get into flow as well.
When you're having a really bad day or really stressed, what's your go-to method to calm down?
Yoga's my go-to method. If I can do a really hard, very difficult yoga class at a yoga gym where I'm not at home and there's no distractions, I always come feeling much better when I went in, and I never regret it. So it's something that I try to do as much as I can.
All right. Is there something that you really still want to learn about, or that you haven't learned yet? Could be a skill or could be a field that you want to dive into that you plan to do in the next years?
Oh my gosh, there's so many things. There's so many things. I am very interested in longevity, and that's something, of course, that a lot of the the biohackers out there are as well. So that's something that I've learned a lot about it in the last few years, but I've taken a special interest in it, and will continue to just really dive into that field. But also just learning other things that I haven't done. I'd love to learn how to skateboard. I never knew how to skateboard. There's things like that where I feel like at this point I should know some basic skills. But longevity is a big one for me right now.
You seem to be quite a fun person to be around. Also, judging from your Instagram when you're jumping around the sand, and by the way, to all the listeners, follow Amy on Instagram. It's entertaining, and it's always very, I think, providing a positive vibe. Like I said before, I think you do that really well. So,
thank you.
Is there someone that you would love to change shoes with? So be in his or her shoes for one day.
I think that I would love to be in the shoes of an amazing singer or dancer for a day. Just because I'm not a good singer. I dance, but not all that well. And I just can't imagine being on a stage. If I was Madonna or someone, being on the stage and just having just belting out amazing songs and just dancing like crazy, and everyone's just cheering for me. I think that would be the most fun that I could have, and I would love to do that. So Madonna, if you want to trade places with me, I'm up for it.
All right. We'll reach out to her. Okay. A couple more questions, Amy.
Yep.
Is there something that you believe in, but you can't prove it yet?
I believe in the power of the mind, and I believe it's more powerful than even those of us who know it's powerful believe. You know, we've talked about the mind-body connection for a long time, and we're starting to finally see a lot of scientific evidence that backs up the idea that your mind actually has much more control over your body than we thought it did. And I think that that's absolutely true. I think in the future we'll also see that our mind is able to communicate with other people, with animals. Like, essentially, I think that this idea of our minds being more powerful and that the energy within our minds, I think it's more powerful than we think it is, and it actually can do quite a bit more than we're doing with it right now.
Yeah, I mean, I totally agree. I believe that as well, and that happened to me several times. I totally believe in manifestation, for example, which is you know, someone who thinks of anything could be, you know, that bottle, and you bring it into reality. And I think that we can do that in our lives as well. And that, you know, your bodily processes and your reactions, they will adjust to maybe a thought or some idea that you have and that you really want to happen. Yeah. And I totally believe that as well. Yeah. All right. Okay, this is also more of a fun question. Is there a time that you would travel to if you could? And what would that time be? What would really interest you?
So I would love to travel about 100 years into the future, like not super far, but far enough that I can see where we are as a civilization. Like I'm very nervous about what's coming up, you know, as far as like climate change and a lot of the sort of things that we've done to ourselves that are looking fairly dismal. So I'm really hoping that if I travel 100 years from now, then I could see that like humanity has come together and we've had all these great ideas and we've fixed all these problems and the world is really going to be fine and it's all great. So that's what I'm hoping. I'm not sure that is how it's actually going to be, but I would love to do that. And then come back here and be like, you know what, guys, it's okay. Like, we're going to be okay. I don't know.
That sounds like a plan. But yeah, maybe you want to stay there then and you won't come back.
Well, that's true. I may stay there, although I've got a lot of family and things here, so I'd probably come back.
I never had someone who wanted to travel so far in the future. Everyone always wants to go back.
Oh, yeah?
I
just want to reassure myself that like we're not destroying our planet and our world and our civilization as we know it. Like surely we're going to be okay. So I want to reassure myself of that, even though it may not be the truth.
Well, if there are more people like you, then I think we have a good chance. Especially now, because you also in the biohacking field. That's what I like about this field, because you know it allows a lot of room for you know, developments in different fields, and people think up things that just haven't been done before. Like, you know, someone living to 180 and being healthy and still being sexually active. So, right. So I really like that. And well, Amy, I think I pretty much already approached the end of my list. But I think our listeners have a great idea what you do, and if they want to reach out, do you have a website that you want to mention that they can go to and check it out?
I have a few websites. The easiest way is probably to go to dramykillen.com. Killen is Killen. And I'm also on Instagram, Dr. Amy B. Killen on Instagram, and Facebook also, but more Instagram. So those are probably the easiest ways. And then I can route you to my other various websites and things and clinics and things like that if you needed that.
All right. And to the listeners, if you like that episode and if you like Amy's work, then take a screenshot right now if you listened on your phone, and then post it and tag Flowgrade and tag Amy. And also check out the show notes on flowgrade.de/sex. I just made it up. And you'll find all the links and the show notes there as well. And Amy, I have one last question for you.
Okay.
Which is, if you could put one thought into everybody's mind, what would that thought be?
I think the one thought would be to be present, because this moment is never going to happen again. So, you know, just soak it up and actually be there for it and be present to it when it does happen.
Thank you. What a wonderful way to end this episode. At this point, thank you so much. I really appreciate you. I appreciate your work. I appreciate your time doing this with me. And also having met you in London and the presence that you have, and keep doing what you're doing. I'm sure you're going to have a lot of success that way, and also helping a lot of people. So in the name of all my listeners, thank you very much for being here.
Thank you, guys.
All right. And I'm going to talk to Amy and say bye to everyone, and see you next time. Bye-bye.